I've had a treatment before with Brian, or Dr. Rambaransingh, and it's been quite good. So I'm hoping to repeat the success and kind of ease off the medication a bit.
Take that assessment, stuff it in your pipe, Paul.
So my back, after years of competitive sports, is in a lot of pain. Nerve damage, constant discomfort in my personal life and at work. It makes it difficult. I'm still involved in sports, but I'm on several pain meds. It even now has gotten to the point where it just limits my ability to do the things that I enjoy doing.
Mm-hmm. Sideways like a bird all the way up. Shoulder blades here. So, I mean, what that tells us, right? So we know we're activating different muscles. So when we're bringing your arms up by your side, we're talking about your trapezius muscles. When we're having you doing push-ups, we're looking at kind of more like serratus anteriors, and ones that wrap around to the ribs. And then when we have you going this way, that's kind of bugging you. It's getting into the rhomboids, that sort of thing. And that's kind of pretty much where you're pointing at. So I think there's a few layers we get to, but I have to make sure I get down to that level for you.
Yeah.
Then we'll see what it's like after.
Okay. Yeah. Good.
Okay, have a lie down. Right now, we're just going to do a little bit of trigger point injections. We're going to do it under ultrasound because the problem is that the rhomboids are close to the lung, and under ultrasound is probably the safest way of doing this. We want to make sure we don't cause a pneumothorax. The effect will be?
Yeah.
Well, that's an interesting question. All patients ask that. They always think, oh, it's what I'm injecting in it, but it's not even really so much what I'm injecting in it. It's the needle work that provides a mechanical release of this muscle. It's just tough to get at. Right? So if we can get in there and get the needle to do its work, cause some triggers to occur, muscle twitches, then I think Cody will do quite well, from that perspective. So that's what we're going to start off with. And see how he responds. We can see here, these are the middle fibers of the traps, and then we're getting into the rhomboid. These are the intercostal muscles. These are the ribs. And this is the pleura. So a trigger point is interesting. So there's two types of trigger points. There's an active trigger point and a latent trigger point. A trigger point is typically entrapped inflammatory mediators within the muscle. It results in taut bands as the muscle responds to it. So, and there's active and latent trigger points. So an active trigger point is where it will refer to other parts of the body when you push on the trigger point, whereas a latent trigger point is just focally tender on the area and does not radiate to other parts of the body. So we then do needling, just dry needling, so we're not injecting anything. And then we measure the trigger points afterwards, and it shows we can decrease the size and actually help relieve some of this muscle tension and these trigger points. But then we have to do physiotherapy. So we have to lengthen the muscle tendon units and work on putting the muscles into a proper position, with posture retraining and scapular stabilization and this sort of thing, in order to make sure that these muscles are put into a position that they don't have this happen again, right? So